Hello, everyone, and welcome to the last session for today. I have the pleasure of introducing Miss Leslie Petroff, a health educator with the Northeast Pennsylvania Area Health Education Center. She has over 20 years of experience in public health and is passionate about addressing health and public health issues, including especially in rural and underserved communities. In today's session, she will be addressing her journey in her public health career and how we can also achieve a career in public health. Let's give a warm welcome to Miss Leslie Petroff.
Thank you, Angela. Thanks for the warm introduction, and thank you for being able to accommodate this presentation. I'll share the screen so that I'm excited to use Pear Deck. So it's the first time, very excited. Okay, so thank you for joining. So as I mentioned, my name is Leslie Petroff. I'm a health educator with the Northeast Pennsylvania Area Health Education Center. So what is public health? So take a minute to type a word to describe what you think public health means to you. So taking care of the public with diverse backgrounds, herd immunity, equity, community, health education, global, collective health, learning about issues related to health in the context of society, healthcare for everyone, social determinants, CDC, provide, education, public health policies for the community, public health as a focus on improving the overall quality of life for people who live in a certain part of society, and sanitation. Great job. I love that. So in addition to all your words, when you look at public health, you see there's a broad definition of what it entails, and it encompasses so many things that when you think about the team and the collaboration, and we're talking about the theme unity in healthcare, public health is one of those fields that brings everybody together and the collaboration that you see. So what is public health? Public health promotes and protects the health of people and the communities where they live, learn, work, and play. Those of us working in public health try to prevent people from getting sick or injured. We also promote wellness by encouraging healthy behaviors. From conducting scientific research to educating about health, people in the field of public health work to assure the conditions in which people can be healthy. And this is from the American Public Health Association. So the public health system focuses on prevention through population-based health, promotion by promoting those public services and interventions which protect entire populations from illness, disease, and injury. And I love the idea of thinking about it, looking under a magnifying glass and really getting down to the issue and looking at some of those initiatives that we see in the communities that we serve. The public health degree programs, when you look at it and you think about today's public health professionals, what are the far-reaching problems that we faced, especially when we think about the coronavirus pandemic, and really we had to come together as the public health and try to think about the way that it changed everything and the practices that we had. Thinking about the opioid crisis, the annual flu epidemics, our community safety, our healthcare policies, and so much more. There are many degree programs that can prepare you as students to meet these needs and other emerging challenges on a local, state, or national level. So there's various programs, and we won't go into everything, but I can help you after if you have questions about exploring programs and looking to see the answer for loan repayment options and any scholarships or any options in that place, even looking for community service or building your service hours. But you look at them, there's a lot of certificate programs that now at the bachelor's level and the master's level that are being offered to really complement any health professional degree. So what can you do with a public health degree? So graduates of public health programs can find a range of jobs in both the private and the public sectors. Public health professionals are needed in government, public, private, academic, and nonprofit settings. And salaries for people with public health credentials vary widely depending on what field they specialize in and what type of employer they work for. You'll see today that a lot of healthcare professionals have a degree in public health in addition to other credentials. So type in a job title that you know for public health. So when we see some of the responses, social workers, masters in public health, policymaker, epidemiologists, pediatricians, hospital administrator, again, epidemiologist, education, health educations, sanitarian, researcher. So awesome job. You're right on topic. Just thinking about some of the examples of the jobs that we have, a lot of them you have said to start thinking about. The great thing about having a career in public health is that you don't have a problem finding a job. There's always something that you can find, and depending on your passion and what you want to do with your degree, there's so many opportunities that are available. So when you look at this image, you see just some of the common jobs that are available. Then you have more specialized and unique jobs, then some non-traditional jobs, and then potential opportunities for other jobs that you'll see in combination to other degrees. That's what most health professionals will do, is combine it with a public health degree. So some of the common public health roles include community health educators, and that's what I am, an advocate for the health needs of specific populations, providing healthcare education and helping residents access healthcare services. We have environmental sciences that apply their knowledge of the natural sciences to address issues affecting the environment and people's health. Epidemiologists who investigate public health threats, identify causes and risk factors, and recommend prevention and control measures. Health administrators that work in management roles, overseeing people and organizations devoted to disease prevention and public health. Public health advisors work in a variety of public health programs, providing guidance and assisting during disease outbreaks. Program planners develop public health programs that inform communities about the health topics and train other community health workers. Public health care workers like nurses, physicians, dentists, and dental hygienists combine specific knowledge of a population with clinical expertise to provide health care to entire communities in federally qualified health centers and to public health settings like schools and low-income and senior housing. Social and community service managers work as administrators in social service programs. So do you have a clear career path? So a thumbs up or a thumbs down? Okay, so great job. It looks like some do, some don't, some are somewhere in between. Now, what I find is any time that I've been in a decision to make for my career, I've come to a crossroads. So you're deciding which path to take. So then my career path started with my bachelor's of health science. Then I had my master's in public health. And then I worked in government, in the healthcare system, and in a nonprofit organization. So I received my bachelor's degree from the University of Miami in Florida. I was a pre-physical therapy major. And then the program I was enrolled in was a 6-year program. And in my junior year, they changed it to a 7-year program. So then I increased my minors to add psychology to my minor to do both sports medicine and psychology. So I graduated with a Bachelor of Health Science. I worked during school. Again, I had a lot of scholarships and grants, but I worked with the work study program and the different experiences. The best one was looking into the medical field, working at the hospital in the area. And I got into research and working with an ear, nose, and throat physician, and then an orthopedic physician, which really got me interested in surgery and learning more about public health. And then I did a lot of volunteer hours because that was part of the requirement for the physical therapy program, to get a lot of the community-based hours. But then what happened at my crossroads, once they changed the requirements for the hours, I had to reevaluate what program if I was going to continue looking at it. It was a part where you're not encouraged to work when you're at the levels. At the time, the PT field was very saturated, so it was a very competitive program. So looking at all of that, I decided to meet with one of the local recruiters on campus who had said, finish your degree and then come on so that you can join one of the branches with either a higher rank or come in as a commissioned officer. So I decided to go the non-commissioner route. So I joined as an operating room technician. And that was really based on my experience working with the orthopedic surgeon that I worked with at the hospital. And it really gave me a lot of opportunities and really began my passion for public health. So I did education and I was the infectious disease coordinator. So really looking at when you're thinking about all the process improvement opportunities that are available when you work in a surgical setting. And especially after 9/11, it was really difficult. I was supposed to go into the Baylor program for physical therapy, but then my application was denied because of 9/11 when they had to stop some of the, they didn't do the stop loss, but they didn't want to lose soldiers from certain specialties in order to be able to maintain their services. So then that's why I decided to get my master's in public health to be able to continue and then go into the medical service corps. So I had the loan repayment program as an option. So that's how I joined. I had all my loans repaid, plus they paid for my master's degree. So I got that through Torrey University in California, which was very popular in the military setting. And then when I left the military, then I came to move to Pennsylvania. And actually we had a very popular physician who worked here, Dr. Enche Salma, and he was a cardiac surgeon and I was a cardiac specialist. I was the trainer for open heart surgeries in the Army. So that was really exciting to me that I wanted to get into work. But then I saw some different opportunities to get in for public health and more of the recruitment aspect. So I worked with physician recruitment. And then I went on into human resources recruitment and then went on into the development side, which I really love the training and development aspect of looking at it. And then you still get to do a lot with public health. You have more hands-on, more community outreach. So really that was the niche that I found, being in the crossroads, thinking about which path to go. And then now I work for the East Central and Northeast Pennsylvania Area Health Education Centers. So we work to improve the supply, distribution, retention, quality, utilization, and efficiency of a healthcare workforce committed to underserved populations. We bring the resources of academic medicine to address local community health needs. And the strength of our AHEC network is the ability to creatively adapt national initiatives to help address local and regional healthcare issues. So this is the most entailed public health position that I have, is in my role as a health educator. So have you ever heard of AHEC, the Area Health Education Center? The question we most often hear is, who the heck is AHEC? Thank you for responding. I'll show you. So like we usually see, most people have not heard of AHEC. So I'll give you a little bit of background. So the Area Health Education Center, our programs focus on healthcare workforce development and community health education. Our healthcare workforce development efforts aim to improve the supply, distribution, retention, quality, and efficiency of all health professionals. So we seek to reach this goal through recruiting, training, and retaining healthcare professionals in our region. Our community health education efforts bring awareness of pertinent health issues to people in our region, and we evaluate public health needs of communities and provide educational programs for children and adults in response to those needs. So if you can, drag the flag to the state that you are from. Ooh, nice. Great job. Thank you for responding. So thinking about that, when you look at it, AHEC is a national organization, and you could see the dots. All the red dots are all our AHEC centers, and then the black stars are our program offices. So you see we have a center or program office operating in almost every state. Our role in public health is to recruit, train, and retain, and we do this by connecting students to careers, professionals to communities, and communities to better health. Strong community partnerships are the key in making sure people get connected with healthcare resources they need. And that's what we do, is focus on strategic partnerships that help us to meet our mission. So a day in the life of the health educator is really, most of my time is spent in education and community outreach. And we do a lot of prevention training. So when you see some of the programs that we offer, we have our Pennsylvania AHEC Scholars Program. So that's a 2-year program for health professional students, and it really gives them a unique opportunity to get immersed in the communities that they're served, focusing on rural and underserved communities. We offer mental health first aid training in both the youth and the adult curriculum. So those are both 3-year certification courses that help you to become more aware of the signs and symptoms of mental health challenges and how to be able to respond accordingly. We offer the poverty simulation, which gives students an immersive experience in dealing with poverty and living in the shoes of somebody who's experiencing poverty. So then our two prevention programs are the smoking cessation and the diabetes prevention program, which are both through the American Lung Association and CDC curriculums. So that's a really opportunity that we offer these free trainings in the community. Then we offer the accredited community health worker training program, which gets individuals trained to be able to be that community liaison, connecting patients to their providers and the community. And then we offer the medical secretary training program, and then Search Academy, which is our students exploring and researching careers in health. So we start early, educating students in K through 12 about potential careers in health and really getting them the resources and the information that they need. Some of the things that we offer are discounts for the Princeton Review. So we start early with the SAT and ACT, leading up to the GRE, and then the MCAT and the DAT. So our goal, again, is to recruit, train, and retain. A lot of it prior to COVID, we were really out in the community and training, being on school campuses, really engaging and interacting with students. And now we've really transitioned to virtually, and then going back now as restrictions are lifted to be able to meet with students and really meet the needs to help them so that you could be successful as a health care provider. So a future in career in public health, when you look at the Bureau of Labor Statistics, it projects 4.6 million new healthcare positions by 2028, which includes 3.4 million new jobs projected in healthcare and social assistance. Researchers, educators, and social workers represent a fraction of the public health careers that will see consistent growth in the next decade. And public health professionals are essential to every community. With the recent global pandemic, there is more need for public health professionals than ever before. So here's a chart so that you can see the job growth for careers in public health, where you could see the wide range of career opportunities that have projected job growth between 2018 and 2020. And you see how it's really improved. And for us, that's great news, where you're looking to see, with our community health worker training program, looking at the 13% increase, it's really a great opportunity for all the community health workers that we're training in our areas. So the public health future trends, you'll see that public health professionals face unprecedented challenges and opportunities in the coming decades. The trends include the aging of the population, changing patterns in the US racial and ethnic composition, changes in healthcare delivery systems, the explosion of information technologies, changes in the public health workforce, and the growth in health-related partnerships and anti-government sentiment and polarization. Public health leaders and policymakers need to take these trends and implications into account as they plan and prioritize future approaches to disease prevention and health promotion. So the great news is that there's always opportunities when you have a career in public health. Now, when you look at it, this is a quote by Ralph Waldo Emerson: "Do not go where the path may lead, go instead where there is no path and leave a trail." So when you reach that crossroads, it's thinking of which path to choose. Sometimes the easier path is not the way. Really figure out what's really good for you in your career. So I thank you for your time. We'll answer questions now, but any additional questions, you have my email. So it's lpetroff@ecneahec.org. I appreciate everyone's time so late in the night, right? You waited extra for the program. So don't be shy. You could ask any questions.
Feel free also to raise your hand if you want to ask a question. Would love to have you guys. I'm seeing some questions start to come in, so why don't I read them? What is the difference between getting a master's in public health and a doctorate in the real career world of public health?
So it depends with the degree. When you're looking at it, it depends where you want to work and what the requirements are. So looking, if you're going into more research and academia programs, then the doctorate is really preferred. Again, we'll talk about a little bit when you think about certifications that are needed. We look to see there's some that are highly encouraged for some departments, but everything is based on the role and where you're working and the areas. That is, so you'll have some credentials that will be useful in some jobs and then they're not useful in other jobs. So it all depends on where you're working and in which sector. So for us, for any of the trainings that we do, we're either instructors, so we have instructor certifications or facilitator training certifications, anything you need for your credentials to be able to have the roles that we provide any of the programs.
All right. And kind of based off that, can you get into a public health graduate program with any science major, or do you even need a science major?
So for the most part, you won't. All the requirements now, because public health is so broad, you'll look at some of them, and the nice opportunities with having additional certificate programs. You could go in and start with the certificate program and then go into the public health program. A lot of programs now will automatically offer, once you're in the bachelor's program, they'll have an accelerated course into the master's program. And then even if you wanted to get into the doctorate program, if they have them available. So it doesn't, anybody could really get a degree in public health. Most of our students who are physicians will actually get a degree in public health while they're waiting to get into medical school. And it really adds, when you start looking at physicians' credentials, you'll see how many have a degree in public health.
Great answer. Another question we have is, what are the requirements to take part in the AHEC programs?
So for our AHEC programs, we don't have really any requirements. We look at them to see our community health worker training programs. As long as you're interested, we're able to come. Some courses, I should say that our AHEC is grant funded. So we are funded through HRSA, the Health Resources and Services Administration, and then the Pennsylvania Department of Health. So we try to offer all our programs at no cost if possible. With the community health worker training program and the medical secretary program, we partner with our local community colleges. So there's a fee that's involved in that, but then we partner with the local career links to be able to offer scholarships to cover those costs. So that's really some of the restrictions that we have for the participation. Otherwise than that, it's just the requirements to meet for the programs. Like for a scholars program, you have to be enrolled in a health professional program. And then our Search Academy program is for high school students. So requirements like that just to meet like the categories, but we really make it easy as possible to get out and engage with the community and really help with that prevention piece of it for all of our trainings and to make it affordable.
Awesome. Another question is okay. The phrasing of this got me. How can I use public health knowledge as a physician?
Oh, public health knowledge is awesome, especially when you see when you see how the field is evolving and looking at it, especially this past year with the pandemic, just having that knowledge base of when you're looking at disease prevention and outbreak, and depending on the field, because it depends again, like which route you want to go and what sector, how it is. But just as a physician, it's really valuable because you gain more of that insight. And when you start with the bachelor's degree, you'll have different coursework, and then your master's degree really gets into more detail about some of those specifics, whether you go in and you do your dissertation and you present and you're able to get published and do a lot more that it has you get into that research aspect of it to see a little bit more. So it really helps as a physician. It helps it adds to your credibility and gives you a more knowledge base and understanding of some of the challenges that the communities are facing.
All right. And the one that's a little bit more specific is, how or can you get a job in public health if you have a bachelor's degree in a science field and are currently going for a master's in public health? Is there a place to send your resume?
Yes, that's a great question. So that's the nice thing with public health, depending on which organization you're going to work for and what sector. A lot, especially for the nonprofit organization, really you have more opportunities to come in to gain experience on the site, where they'll do on-the-job trainings and really pay for all your certification. So working in all the sectors, when I worked in government, in healthcare, and now for a nonprofit, each organization will pay for the certifications that are required as part of the job. So when you come in with extra certifications, it's nice if you already have them, but if you don't have it, your organization will help you to get it. So you can get a job anywhere as you look for positions. And that's actually sometimes you need it when you try to go in to do some of the certifications that are offered. Then you see that you need some work experience. Like if you're looking for the certified, they have certified in public health. They have the big one that you see is the CHES, the certified health education specialist, and then the master health education specialist. Those all require some academic requirements and then employment opportunities that you need to be able to have some job experience with it. So that's why it's nice if you want a job like that, and we could help you. We provide those services, especially to our pre-health professional students, some sites where you could get some paid internships, some volunteer opportunities, what you're looking for employment, and really help you to see some of the options that are available.
And then kind of going off of that, do you offer any paid positions in AHEC?
Yes, so it's very exciting. We are actually expanding. We've hired 2 new health educators. And again, like I mentioned, we get a lot of grant funding. So we have 2 new grants that we're going to be working on. So we're hiring positions for that. So we're hiring health educators for that. The nice thing with AHEC is the experience will vary. You don't have to have, depending on the position, some require a lot of education or work experience, but because when we have a grant, it's actually geared for a specific program, we'll train so that you're prepared for the position that you're going to do. So as long as you're passionate about the field and you take that initiative, we train you and you're able to work and start learning on the job. So we do work with a lot of interns who then get employed by us, or then we make the connections in the community where they find employment as soon as they graduate.
Awesome. And then I feel like this question kind of also goes a little bit more with it. Are there any public health certifications, aside, of course, from PhD and master's, that you would say add credibility in the field?
Yeah, so again, it's the same. You'll see the popular ones, again, that certified in public health and the CHES and the MCHES that are really more common that you'll see credentials following somebody who has the master's in public health. But then you'll see, like, we do certifications for tobacco. I'm a tobacco treatment specialist. And then there's more certifications that way, depending on where you're working and what initiatives and what fields. So again, it's really important to, when you look for the jobs, looking to see what they require, really talking to the employer, because your employer will provide those opportunities and pay for memberships and certifications and all the requirements that you need.
Are these AHEC positions in Pennsylvania, or are they all over the states?
So the great thing is that Pennsylvania, that the AHEC is a national program. So depending on the state, I could connect you with, you could go to the National AHEC Organization website and you could find your local AHEC to see what positions are available. But for us, it's the positions are here. We're offering positions in the East Central and the Northeast. And then because we have this statewide grant, we actually have positions throughout the entire state. But that's not always the case. It depends on funding opportunities and what's available. But you could check the national website and there are opportunities across the state. And we're actually a smaller AHEC compared to some of the other states. So you could see some of, when you look at opportunities that are available, a lot of states might have even more opportunities than we do in Pennsylvania.
That's awesome. Okay. What type of research is done in a public health PhD? So
depending on, you choose your project. I know, like when I did my master's, I was working on MRSA at the time, and my advisor was actually working on his PhD, who used my research for his project. So it looks to see, it depends on what you're looking for and what your interest is. And you have that option. Then when you start working on your dissertation and looking at the research opportunities, you work on that in like the IBR process and everything that's involved. So there's a lot of different opportunities. Like, it's exciting this year to see what's going to happen with COVID and to see what research comes out of it and what's been starting already. So we'll start seeing more and more research that comes out, even with the vaccine, just looking to see how you're looking at the different age brackets and what's the difference and what's the efficiency of it. So we look at all of that to see any of potential side effects for the future, right? To look at chronic diseases, if there's any implications with that. So you look at that, there's just so many opportunities, and depending, it's really endless that way to see, depending on what program you're in and how they connect you or what your interest is. There's a lot of opportunities. So it's open again because it's so broad. Even when we were just thinking about how do you describe public health, it's just such a broad spectrum. There's so much that's available to do.
Awesome. And then given that there are so many roles in public health, does one necessarily need a public health degree to get into a public health field?
So you don't, not necessarily. You'll see where they'll either do, especially if you have any, nursing background, any other health professional degree, you could get into a public health position. Again, that's saying where the organizations will train you specific to your job, especially when you get into like community health. You'll go in and you'll have different certification requirements and different trainings that will be available. It just adds, depending on if you want to get more into that research aspect, then that's where you really need to focus on having the public health degrees and getting the proper credentials for that.
Awesome. Students, you could still send in your questions. I have another one for you, and it is, what interested you about public health and made you want to pursue it?
So pretty much so in the Army, like that's a really great question. Looking at it, I was really set on physical therapy my whole life. I really liked the athletic training aspect of it. I did a lot of volunteer work, even in high school, going in. And then I always had a passion about, just paralysis. So I was really fortunate to be able to volunteer with the Miami Project to Cure Paralysis. And then when I started to get into looking at all of that, where then you're having surgeries and you're having infections. So when I worked with the orthopedic surgeon and I was able to go into the operating room and shadow and see, and then you start seeing everything else that starts, right? That things that you weren't aware of. Then when I was in the military and you're seeing, especially after 9/11, we had a lot of different, more intense surgeries coming through, a lot of amputations, more skin grafts and implants. So then you started looking at all this research about, infection and the, so the epidemiology side of it was like really exciting but then looking at all the research and looking at, so that really was the part that I liked. And then looking at chronic diseases, especially working in the operating room where you're seeing some, terrible things that come in where they are preventable. So preventable diseases, but then you're seeing the other side of it, and then sometimes it is too late. So that really had just sparked my interest, just wanting to go in and learn more and doing it. And now being able to work with our academic partners and working with students is really exciting to see and learn more about the career. It's always changing, it's always exciting. You're always learning something. So that piece of it is what's the best part of it.
Amazing. I love that response. So I have another question come in. Do a lot of people who work at healthcare or healthcare education nonprofits have a background in public health, or which other types of professionals work day-to-day tasks of a nonprofit?
So it all depends. We have different roles that come in. So you have a lot of and depending on what type of nonprofit organization you work for, you always need administrative positions. If you have a financial background, you always need somebody to run the business aspect of it. And then depending on what programs you're working with, because you think about some of the nonprofits like our some of the homeless day centers that are run, those are nonprofit organizations, and most of it will be social workers, or you're looking at some community health workers that work just to make the connections, especially if there's when you look at the health disparities and any social determinants of health, really getting into, so the positions are broad. You could come in and not have a degree and be able to start off and then get trained for positions. So that's the really nice part of, if you're passionate about public health, you could get started while you're a student to start volunteering and seeing what opportunities are available, and that could lead to a paid position. And then more where you want to look at opportunities for tuition reimbursement.
Sounds like public health is an ever-changing and ever-developing field. Someone is very interested a little bit more in the service aspect, specifically what program in the Army allowed you to work in medicine? Did you do boot camps or were you active duty?
Yes, so I joined as active duty, and then I had a lot of opportunities to go to the leadership trainings to then advance in rank. And then since I'm bilingual, then I did a lot of recruitment missions to go to some of the underserved schools to be able to recruit high school students and tell them about the health careers, and giving them that opportunity to see the same thing when you're thinking about challenges when you're trying to pay for school, especially if you want to get into medical school. And the Army, I was in the Army, so I'm going to be prone to the Army, but I have a lot of friends who were in the Air Force and the Marines. Like, all the branches of service really offer great opportunities, especially for health careers. So we offer a lot of opportunities when you think about the National Health Service Corps, and then looking at even the Peace Corps or AmeriCorps. It's that same way when you think about the military. There's other opportunities if that's what you like and you go for it. And then the best part was I did a lot of humanitarian missions as an operating room technician. So going in, like, where I used translation services was going to Paraguay to do cleft palate repairs and doing some surgery. So that's really exciting where you look at it, those opportunities. And then you're looking at public health that way because you're setting up a hospital in a third world country and thinking about everything that you need for infection prevention. So those are the opportunities that are really nice. So it was, yes, that way, full force with all the training, boot camp, active duty, all the fun stuff.
Sounds like it worked out in the end, though. Would it be beneficial to have a teaching certificate to be a public health educator?
So that's a great question. And it is. Anything is beneficial when you really look, especially when we look at AHEC. When we're hiring candidates, we're looking for people who are outgoing and willing to talk and able to teach and present information to connect with the communities that we're serving. And some of that you're looking at, we have challenges with health literacy and social determinants of health, especially looking this year after COVID. You think about we converted all our programs to virtual programs, but not everybody, especially when we're serving rural and underserved areas, not everybody has access to computers and internet. So really getting creative of, especially with the meeting guidelines, like where do we meet participants to help them, still do it, especially at this time with smoking cessation, where it's a stressful situation. If they looked at that, you want to make sure that you're giving them their NRT, right, their nicotine replacement therapy, so that they're able to be successful in their journey to quit. So we really get creative that way, where you just have to be willing to be outgoing and make those connections with the individuals that you're working with. So the teaching degree would be awesome because then you're gaining those skills.
What do salaries look like for health educators or for community health educators?
Oh, so that's great. So the salary ranges vary. So you could go anywhere from, starting, so 40 to 45,000, and all the way up when you look up at some of the other specialties, you could go into the 6-digit figures. So it depends on the area where you're working and what sector.
All right. If no one has any more questions for us in the Q&A or wants to raise their hand really quick. Any last takers? No.
Yes, we could reshare the email.
Perfect. All right. Well, if anyone has any other questions, Leslie has wonderfully offered to answer those in case you're maybe too shy to say it on our live stream. But thank you so much for coming and spending this time with us and being able to work with your schedule. Thank you for audience members for staying a little bit later. I hope this session was worth the wait. Please don't forget to fill out the survey about session feedback. Leslie, thank you for joining us.
Yes,
Have a
thank you,
wonderful
everyone.
day.
You too.